Hello, everyone. We are the Pre-PA Mentorship Program, and welcome to our TED Talk. Today, we will begin our presentation by discussing the story of Nayeli Campos, a pre-PA student whose journey felt very close to home to all of our group members, as either first-generation students or coming from lower socioeconomic backgrounds. Nayeli Campos is a first-generation Mexican-American student from Los Angeles, California, raised in a household with 5 siblings and limited financial means. Lacking access to healthcare, she found herself serving as an interpreter for her parents during medical appointments. Witnessing firsthand how language barriers contributed to misunderstandings between patients and providers intensified her determination to offer quality patient care to disadvantaged communities. Regrettably, she lacked adequate guidance and mentorship until she discovered Vida Mobile Clinic in 2019, an up-and-coming nonprofit organization dedicated to cultivating and facilitating groundbreaking mentorship initiatives while promoting inclusivity to empower the future cohort of diverse healthcare leaders. Nayeli recounts that it is only through Vida Mobile Clinic that she was able to find opportunities such as shadowing, hands-on clinical skills, and even CASPA and interview assistance to finally further her journey towards getting into PA school. So many of you may be wondering, where is Nayeli now, 5 years after this opportunity? Thanks to this pre-PA mentorship opportunity, Nayeli successfully gained entry to various prestigious PA programs on her first cycle. She will be attending the USC PA program starting August 2024. Drawing from triumphs, stories like Nayeli's, and even our own, we have opted to persist in providing complimentary mentorship opportunities for aspiring pre-PA students. So our problem statement. Our project was initially conceived to address the needs of students from lower socioeconomic status backgrounds, including first-generation students who may face barriers to accessing resources available to their peers. Our aim was to provide a free and convenient mentorship solution tailored to aspiring PAs or students interested in healthcare, with the goal of leveling the playing field and increasing opportunities for these students. While our initial aim was to reach a broader demographic of underserved individuals through virtual opportunities, we chose to focus on service planning areas South and East LA, with the idea that it is still open to students from any area. So now I'm going to hand it off to Yesenia.
Based on our research, we found that South and East LA continue to be one of the most medically and educationally disadvantaged areas in LA County. According to the LA County Department of Health SPA data, the percentage of students graduating high school in South LA is 25.1%, with East LA following closely at 28.1%. Let's compare this to other SPAs in LA County, such as West LA, in which only 6% of adults have completed an education level lower than high school. As with the example of Nayeli, those who are able to graduate high school and attend a university continue to have difficulty obtaining the resources to thrive in the college setting and successfully graduate college. In South LA, only 8.6% of adults hold a college degree, compared to East LA, where 14.8% hold a college degree. Just a couple miles away in West LA, the number of individuals who hold a college degree is 55.8%. That is 7 times more likely to obtain a college degree if you come from that area. This is highly due to the tools and resources that are readily available for these students. Because the lower income students are 5 times less likely to enroll in college, let alone pursue higher education, the impact of mentorship and access to resources to achieve their higher education aspiration is very apparent. Although first-generation college students may not have a lot of cultural and social capital, mentoring is a promising intervention that can support them. Research has shown that having more mentors and spending time with them increases the likelihood of first-generation students of enrolling and graduating from college. Furthermore, with our research, we found that one of the Healthy People 2030 goals is to increase the number of students attending four-year colleges and graduating on time, which is something we'd like to also address with our intervention. Therefore, as PA students who are passionate about sharing our profession and increasing awareness, we aim to create an intervention for pre-PA students focused on mentoring individuals while also creating a sustainable resource that was readily available. Next, Victoria will talk about our intervention.
Okay, so now I'd like to talk about our intervention process. We started off with 3 key phases, the first one being the research and development phase. We held numerous focus groups. We conducted one-on-one interviews with students, and most importantly, we administered a needs assessment to gather insight for creating tailored and relevant solutions for our target demographics. And then we moved on to the minimal viable product. So now we actually developed our solution to test out the core functionalities, but we continue to gather feedback from our early users. And so today we're really happy to share that we successfully completed what we call the Pre-PA Hub, which is just a free on-demand online platform that is now live and accessible via desktop and mobile. And then the final phase is the product market fit. So we decided to conduct a pre and post survey to evaluate whether our product actually met the needs of our target demographic efficiently. So we'll share those results later in the presentation, but we contribute our market validation to working with our key community partners and with the initial needs assessment. So in regards to our actual intervention, this is the prepahub.org, and if you scan the QR code, it'll take you to our live website. But just for the sake of today, I'll go ahead and just demonstrate quickly what our website looks like. So you can see here that we have our tagline, which is the on-demand prepay mentorship. You can click on the video hub, which will take you to all the videos, but for the sake of review, I'll go ahead and just scroll down to show you a little bit more about our philosophy, which we take pride in saying that we're very student-centric in our approach. Also, if you just wanted to read more about our services, and also we talk a little bit about our team. We do have a promo video, which we've already shown previously, so we'll skip that for today. And then also, if students need to contact us, they have a way of doing so. So let's go to the video hub. So based on the needs assessment, we picked the top topics that were most requested to create videos for the students that are informative, but also provide pro tips along the way. So we hope to continue to grow this list, but there you can see kind of the topics that we have for now. So I'll go ahead and pass it on to Ariana.
I wanted to take this time to address how we acknowledged factors such as health literacy, cultural humility, and trauma-informed practices. Through the application of the SMOG technique to assess our pre- and post questions, we determined that they were comprehensible at a 7th grade reading level. We deemed this appropriate since our audience ranges from 9th grade to 12th grade and beyond. Recognizing that not all students have access to quality education, it was imperative that we maintain a middle school reading grade level to ensure a comprehensive understanding of our intervention. Additionally, when focusing on cultural humility, we directed our efforts towards creating an intervention centered on flexibility and adaptability. Our objective was to shape the project approach based on feedback from participants' pre-test questionnaires. As a result, the intervention was collaboratively developed by the participants themselves, allowing us to tailor it to the specific needs of the service areas using their valuable input. Our project framework was also developed with trauma-informed practices in mind. We crafted our intervention materials like platform videos to reflect sensitivity to diverse genders, religion, and ethnicities. Given the presence of minor participants, securing parental and teacher consent was also crucial to our process. We also emphasized participation was both voluntary and anonymous and ensured we maintained respectful and professional communication. Furthermore, our intervention also demonstrates our commitment to equity and inclusion. We targeted individuals from disadvantaged backgrounds, including those from lower socioeconomic statuses and attending high schools with low graduation rates. Ultimately, our goal was to develop a solution that is accessible and responsive to their needs. The establishment of a free virtual on-demand hub aligns with this objective and is aimed to mitigate educational barriers faced by this population. Additionally, the versatility of this platform also positions us to extend our reach to a broader audience, including more diverse backgrounds and geographical locations. Lastly, I wanted to highlight the role of advocacy in shaping our intervention. Our aim was to advocate for a population typically underserved in terms of access to higher education and mentorship services, and we believe we did just that. Ultimately, we implemented an intervention designed to reduce the disparity between low socioeconomic status and access to higher education resources. Additionally, we take pride in the fact that our intervention specifically focused on the PA profession. This will ultimately enhance exposure to and knowledge of the profession, which is crucial for its ongoing development. Now next to my peer Elizabeth.
Now I'm excited to present the findings from our assessment of how effective our pre-PA platform has been.
Our ultimate goal was to assess whether our platform provided our students with the outcomes we aim to achieve based on our objectives. So we started with 5 goals in mind for our pre-PA students, which I will discuss in detail later. To measure their progress, we implemented a ranking system ranging from 1 to 5, reflecting different levels of confidence, from not confident at all to very confident. We applied the system to various questions to gauge their confidence levels. So the questions were: 1, how confident do you feel in understanding the role and scope of practice of a PA? 2, how confident do you feel about navigating the CASPA application process? 3, how confident do you feel in utilizing the resources available through our mentorship program for your pre-PA journey? And 4, how confident do you feel about finding shadowing opportunities? 5, how confident do you feel about completing the prereqs for PA school? And finally, how confident do you feel about completing your patient care hours? So as you can see here, a majority of our initial responses were in the not confident to somewhat confident, especially for confidence with CASPA. And you could see that it's mostly skewed to the left side, so our students weren't feeling as confident at the beginning of our project. So following the intervention, we observed a general increase in confidence levels across all questions in our survey. We aimed for a 10% increase in self-reported confidence among our students, and to analyze this, we calculated the average score for each question and then calculated the percent change in these average scores post-intervention. For Objective 1, we wanted to analyze their confidence in distinguishing the role and scope of a PA. So initially we were at 2.05, and then afterwards it was a 2.78 score. So it increased by 35.7%. For Objective 2, we were analyzing confidence among our students in navigating the CASPA application process, which, as we know, is a crucial step in their journey toward becoming a PA. So initially it was 1.44. Afterwards, it was 2.26, so their confidence increased by 56.8%. For Objective 3, we were analyzing their confidence in utilizing the resources available through our mentorship program. At first, it was a 2.09, afterwards 2.78, so it increased by 33.3%. For Objective 4, confidence in completing the prereqs for PA school, initially it was 2.16, afterwards it was 2.94, so it increased by 36.2%. And lastly, Objective 5 was analyzing their confidence in accruing patient care hours. So initially it was at a 1.57, afterwards we saw a bump up to 2.44, so it increased by 55%. So overall, we achieved our target goals and were able to quantify their improvements and growth in different areas. So this really provided us with valuable insights into the effectiveness of our pre-PA hub. And now I hand it over to Danielle.
And for our Star Wish, we identified our first star as being thankful for our community partners, Mrs. Feo, the Vita Mobile Clinic, and UCLA's Pre-PA Club, for collaborating with us on informing and inspiring the new wave of future physician assistants in underserved communities. Our second star was that our PA Hub videos actually served as a useful tool for the participants in our intervention, so much so that there was an overall improvement of over 10% in their confidence in distinguishing the role and scope of practice of a PA, attitudes towards the CASPA application process, utilizing available resources through our intervention, finding shadowing opportunities, completing the prerequisites and patient care hours compared to before our intervention. And finally, our wish is for our community partners to continue to use and share our PA Hub to provide helpful information with not only prospective PA students, but with our other schools and mentorship opportunities, especially those with limited resources, with the hopes of reaching a wider range of participants and diversifying the healthcare profession. As we wrap up our journeys, our commitment remains strong to raise awareness about the PA profession by offering an array of resources. We aim to provide free mentorship to aspiring PA students, support current PA students through mentoring, and even offer guidance to clinical PA students as preceptors. These efforts allow us to give back to the PA profession and contribute to diversifying the workforce. Together, we are shaping the future generation of PAs through mentorship. We extend our gratitude to our community partners, Ms. Feo, the Vida Mobile Clinic, and UCLA's Pre-PA Club, and all the participants for their invaluable contributions and collaboration to complete this project. We couldn't have done it without you. And here's a list of our references used throughout the project. And thank you so much for listening. We appreciate your time. Are there any questions?